Hi, I'm Sarah Dan. I'm an orthodontist who's straightening out the confusion and concern around orthodontic treatment. As I was doing research for my book, So Smile, I surveyed around 400 patients and their parents about what they wanted to know about orthodontic treatment. And one of the important or interesting facts that came out of that research was that patients or parents thought it was socially acceptable for their teenagers to have orthodontic treatment. But if their 7, 8 or 9-year-old patient or child had orthodontic treatment, they were often questioned negatively in the playground or at school, or even the child was asked by the teacher why they were having treatment so early. Now, I thought that was really interesting because the major associations of orthodontists around the world all suggest that you should take your child for an early orthodontic assessment around the age of 7, 8 or 9 years of age. So this includes the British, American and Australian associations. So I found it interesting that there's still this stigma associated with early orthodontic treatment when, as I said, most of the associations actually suggest you should have an assessment at the age of 7 or 8 years of age. At that age, your child is still growing and many of the conditions that are developing can still be treated utilising natural growth. This is a more preventive and interceptive approach rather than a reactive approach. If you take your child to the orthodontist at the age of, say, 15 or 16, most of their jaw growth is complete, and so therefore you have less treatment options available to you, and often they're more invasive, require more treatment and are often more costly. Now you might ask, what is an early orthodontic assessment? An early orthodontic assessment is where you take your child to an orthodontist and they usually take some records, photos, perhaps an x-ray. They'll do a facial analysis, have a look at the patient's teeth, how they bite together, how their teeth are erupting, and then give you an insight of what's developing. Now, most patients don't need treatment and they go on some sort of growth and development monitoring plan. In my practice, that's actually free or complimentary, so that you have peace of mind your treatment is being started at the right time. If they do need treatment, it's often very simple short-term treatment, which is preventive or interceptive to a major problem developing. So in fact, it can alleviate the need for treatment down the track. So even though people think, oh, it's too early, that's not actually the case. It is actually the best way to save yourself time, money, and treatment down the track. So if you think your child may benefit from orthodontic treatment, I encourage you to get an early orthodontic assessment, not because I want orthodontists to have more patients, but it is actually the best way for you to get the best out of orthodontic treatment. If you'd like more information, go to my website, drsarahdan.com.